Everyone, please take your seat. The program is about to begin.
Yeah. Well, in 2020, guess where STD Engage will be? Join us in New Orleans. Can I hear you? And we will see you next year. Woo!
In the spring of 2020, our world changed forever. The hurdles our nation faced were unprecedented. But we knew we had a contribution to make, and we stepped up. And then, when Mpox emerged last year, we were thrust again to the front lines, this time leading the way in raising awareness, figuring out testing and treatment, helping people get vaccinated, and from day one, advocating for a strong response. Even when stretched to the brink, we worked together to figure out how to keep our communities and nation healthy. We strengthened our workforce, created new resources, shared our experiences, and supported each other through burnout. We advocated for our communities and for our nation's health, and we never once took our eyes off the epidemic of STIs in America. Today, we are thrilled to finally welcome you, our community, to the first in-person NCSD Engage event in 4 years. Here, we get to meet face-to-face, learn, share, innovate, and celebrate coming back stronger than ever, together.
So glad to say we finally made it. 3 years late, but guess what? We made it to New Orleans. You all are a beautiful sight to behold, and welcome to STD Engage 2023, coming back stronger. And to demonstrate our strength, I am thrilled to be joined on this stage by outstanding leaders in our field, 8 past board chairs of NCSD. Audrey?
NCSD is thriving. We have emerged from and are still working on COVID and Mpox and the outrageous increase in STI infections, but we're working with new money, new programs, and new power in Congress. It is my honor to serve as current chair of the board of directors, your elected representatives in the STI sector. During my tenure, NCSD will adopt a new strategic plan that emphasizes sexual health, health equity, social justice, and disability justice, expand our membership, and will no longer use the term STIs. We're switching to STI, or we will no longer use the word STI. No STIs. You know what I mean, switching from STDs to STIs, and fighting stigma.
Everybody, NCSD is stronger than ever. When I chaired the board, we boosted our relationships with you, our members, and with our partners across the nation. We set the stage for a new strategic plan. We learned to deal with Mpox, and we helped to guide new DIS expanded funding for programs throughout the USA.
An era of health and racial equity and justice is now. Under my tenure as board chair, we expanded our health equity work and the internal work we did to increase our knowledge, start the tough conversations, and move our sector forward to better deal with the social determinants of health. Our work is far from finished, but NCSD is stronger than ever for it.
All right, y'all. My mic sound nice. Check one. My name is Michelle Allen, and I was so proud that during my tenure I had the opportunity to moderate a panel with the legendary Dr. Bill Jenkins. If you don't know who he is, I encourage you to Google. The reason why the Tuskegee study recipients had justice was because of him. He fought hard against racism, and you need to clap harder for that. Diversity, equity, and inclusion, thank you, the late, great Dr. Bill Jenkins, and the diversity, equity, and inclusion looks just like this panel.
Woo! During my tenure, NCSD laid the groundwork to reinvent STD Engage to make it what it is today, the biggest non-governmental STI conference in the United States. Woo! STD Engage has always been a time for us to come together, talk about our successes, talk about our challenges, and go back with a renewed spirit. New friends who are only an email away.
So I hail from the great Commonwealth of Virginia, and yes, states just like Virginia and states all around the South are making a difference when it comes to STIs. Our collective challenges are great, but the prevention work that we do may look different, but we're all in this together. We're committed to fighting STI rates across the entire United States. During my tenure, when I was the chair of the board, I had the privilege of working with my predecessor and my fabulous friend from California, Heidi Bauer, and we hired the new NCSD director. His name was David Harvey. David, where are you? Stand up, David. Wherever you're at, stand up. Big round of applause for you. We guided his first year, we helped him adjust to this field, and with the rest of the board of directors, we laid a foundation for NCSD growth and the awareness that you see today in this field. We are absolutely indeed stronger than ever.
Daniel from Vermont. But Jeff, something's bugging me here. I have one better than you. I chaired the executive committee that did the search for our one David Harvey. So,
I don't remember that.
Nor do I. But forget that. 14 years ago, when I was the chair of NCSD, we strove to build stronger applications. We developed STD apps. We established not only performance measures, but we were setting indicators for those performance measures. What's really important here for you folks, as a chair of the past, and standing with my amazing colleagues, let history speak to you. The future of STD Engage is out there. STI, the future is in your hands. Over these next couple days, reach out, be engaged, dare I say, get married to the STI fights we have ahead. Let's be engaged, y'all.
Greetings, STD Engage attendees. I'm Charlie Rabins, a founding member of NCSD. I had the honor of serving as NCSD's second board chair from 1998 to 2000. In the early days, we envisioned an NCSD that would fiercely advocate the CDC, Congress, and the administration for the funding and policy needs of state and local STD programs and the communities we serve. We envisioned an organization that fosters the peer-to-peer exchange of science-based knowledge and best practices, knowing that STD DIS, surveillance and clinic staff, and STD directors who are on the front lines are where leadership and innovation happens. We envisioned an organization that would make our field stronger. We have come back stronger from many challenges, including COVID, Mpox, and rising STD rates to do exactly this. We are stronger today, and I believe that we will overcome any future challenges that arise. I had the honor of serving with Dennis Murphy, another founder of NCSD, who passed away 3 weeks ago. Dennis was an ardent advocate for strong and effective STD programs. He was both a diplomat and a warrior and knew the fine line that exists between both roles. Dennis, I honor your work, and I'm so proud to tell you that NCSD has become exactly what you and all of us hoped it would become: a fierce advocate who tells our story and supports folks on the front lines. So welcome to STD Engage 2023, coming back stronger. I love all of you and regret I can't be with you in person. Have a great conference.
Please welcome, on behalf of this year's Engage Innovator sponsor, Hologic, Scott Loudenbeck.
Thank you. Thank you very much. It is once again our honor and our privilege to be one of the primary sponsors of NCSD Engage. On behalf of Hologic, I'd like to extend a huge thanks to the NCSD team that has worked so long and hard to get us this fantastic event live again. I know we all love our Teams and our Zoom and our virtual meetings, but nothing replaces a live meeting to learn, plan, and celebrate each other. Most importantly, we'd like to extend a welcome and a thank you to the over 1,200 attendees at Engage this year. You continue, 1,200 people. You continue to do an extremely hard job under the absolute hardest of circumstances for your states, counties, cities, and most importantly, your patients. You may know us at Hologic as the inventors of the ThinPrep Pap test, or as the makers of the ubiquitous orange tube, otherwise known as the Aptima multi-test swab. Although our direct customers are Quest, LabCorp, hospital, and public health labs around the country, your teams are actually the end users of these products, and you depend on the results for the best possible care of your patients. We're excited to both solicit your feedback and also provide a wealth of resources for your clinics to help you use these tests as efficiently as possible. So from our team to yours, thank you again for your amazing and selfless actions over these last 3 years. And thank you to David and the entire NCS team for getting us back together. We wish everyone a great meeting and look forward to seeing you in the exhibit hall. Thank you.
And now, a special message for our nation's disease intervention specialist from Director of the Centers for Disease Control and Prevention, Dr. Rochelle Walensky.
Each day you, our nation's disease intervention specialists, provide tireless, linguistically competent, community-directed, and patient-centered services for your communities, and you do it with compassion and kindness. You are a community committed to doing good, and many of you have been doing it for decades. You have long been our nation's boots-on-the-ground contact tracers, case investigators, and healthcare navigators, and indeed your work was the backbone of the public health response to the COVID-19 pandemic, and then Mpox. It's astonishing what you are accomplishing in what can be a very resource-limited field. Thank you. I have seen firsthand the power of what you can do. I often tell the story of a particular community health worker I met before I came to CDC, when I was working at Massachusetts General Hospital and caring for those with HIV. He was so connected to the community and his patients that they had developed a huge level of trust in him. If they were lost to medical follow-up, he would unfailingly find them. I recall one such patient who had stopped coming in for treatment. He had tracked her down and learned that she had stopped coming because of her HIV, because of her thinned hair. She was nearly bald and she was embarrassed. And this community health worker found her a wig and with that solution, escorted her proudly into clinic. Only because he was close enough, trusted enough to have that conversation, were we able to be sure that she got the care she needed. And now we face the increase in cases of chlamydia, gonorrhea, and syphilis. reaching a total of more than 2.5 million reported cases. The reasons for the increases are multifaceted, and so are the solutions. For the first time in decades, we're seeing promising new STI interventions on the horizon, but these alone will not solve this epidemic. It will take us working together to effectively use new and existing tools to increase access to quality sexual health care services for more people, and to encourage ongoing innovation and prioritization of STI prevention and treatment in this country. It will take you. While you continue caring for your communities, I commit to you that I will continue to advocate for your communities at the federal level. CDC's recent investments in community healthcare worker programs, and specifically the disease intervention specialist workforce, are about establishing an infrastructure for equitable public health beyond the COVID-19 pandemic, and we will continue to seek out ways in which we can support, strengthen, and empower you, as you, in turn, empower those you serve. Despite the challenges brought by COVID-19 and by the growing number of STI cases, I also see this moment as a very exciting time for public health and community health workers across the nation. The public has come to recognize the value and the need for a strong care system anchored in our communities, and I believe that is what is energizing the next generation of public health and community health leaders. There is no question these past 3 years have been hard. We are tired and we are worn down. Let us grant ourselves a little grace to reinvigorate, to not only take care of our communities, but to proactively and very intentionally take care of ourselves and our loved ones. I am certain you are excited to be meeting in person in New Orleans, celebrate this time together. I only wish I could be with you. Thank you for caring for millions of people in this country, people at all stages of life, people often living in medically underserved communities, listening with empathy to their questions and concerns, serving them in a way that embraces diversity and supports equitable public health. I am honored to serve alongside you.
And now, meet just a few of this year's DIS attendees, STD Engage 2023 DIS Scholarship winners.
Everybody, my name is Ethan Quinnell, and I'm here today from Chicago, Illinois, on behalf of the Chicago Department of Public Health. We're here on stage with our fellow DIS scholarship winners from across the country and want to thank the funders for making this opportunity possible. I'm originally from Minnesota and have since lived in Chicago for the last 5 years, which ultimately landed me the opportunity of becoming a DIS. I've been a DIS for just over a year and work specifically on the HIV response team with the health department. The HIV response team is composed of 5 individuals in which we all investigate new diagnosis of HIV, as well as re-engage individuals appearing to be out of care. One thing I love most about being a DIS is assisting individuals in a complex healthcare system to ensure they receive the proper care that they need and deserve. Thank you again for providing me with this opportunity to share my story.
Good afternoon. My name is Corda Hinton. I'm here from South Carolina, but I am a native of Louisiana. I'm known as the Raging Cajun by many of the DIS in South Carolina. I have been a DIS for South Carolina's Department of Health and Environmental Control for 28 years. Working in the Low Country region. In fact, I love being a DIS so much that when I retired in December 2021, I returned in April of 2022 to work as the DIS preceptor. I became a DIS after working in family planning and preventive health and seeing so many people with STDs and HIV and not being educated about them. One of the reasons I love being a DIS is knowing I'm making a difference. Thank you for providing me with this opportunity to share my story.
Hello, everyone, and good afternoon. My name is Justin Goff, and I am a DIS with the Oklahoma State Department of Health. My Okies there. I've been a DIS for almost 3.5 years now, starting my career in January 2020, right before everything got real exciting. I finished my training the week before COVID was officially declared a pandemic, so needless to say, I hit the ground running. I've served in several roles in my 3.5 years, first of all being COVID response, back to syphilis, and the unfortunate outbreaks Oklahoma and so many of your other states are facing in the wake of COVID. I currently serve as the maternal DIS for Oklahoma, battling the rise of maternal and congenital syphilis. Not the role I would have chosen for myself in the beginning, but a role that I've grown to love nonetheless. I'm absolutely thrilled to be here as a scholarship recipient for the STD Engage with so many of my fellow DIS, and really look forward to the collaboration and opportunities to learn from one another. Thank you.
STIs have risen to record highs, and more Americans are experiencing the most dire consequences. In every community, dedicated STI professionals work tirelessly to prevent, find, and treat these common infections. But chronic underfunding means they don't have the resources they need to stop the escalating epidemic or prevent new outbreaks. We know how to create a healthier nation. At the National Coalition of STD Directors, we're working to strengthen the public health response to STIs. We're building the capacity of health departments, clinics, and community organizations, helping the nation navigate emerging outbreaks, promoting health equity, and tackling stigma head-on.
The fact that this is happening is an echo of the earliest days of HIV. We, I thought, had come a lot further.
And we're creating a sense of urgency around the epidemic of STIs to ensure it's a priority for our neighbors and the highest levels of leadership. Our vision is a nation where all people are empowered to lead sexually healthy lives. With our members and our partners, the National Coalition of STD Directors is working to advance equitable, effective STI programs and services for everybody, in every community, across the nation. A healthier nation is within our reach, and you have a role in stopping the epidemic of STIs. NCSD can be your voice.
Please welcome to the stage Executive Director of the National Coalition of STD Directors, David C. Harvey.
Who would have believed that when we last saw each other at STD Engage in 2019 in Washington, we would face a worldwide pandemic, or that you would be called upon to lead a response to COVID, rising STIs, and Mpox. After our record-breaking successful STD Engage conference in 2019, a long time ago, who would have believed that we would have to cancel the meeting 3 years in a row, and now we're finally here together? Who would have believed it? Same hotel contract, but with double the people we thought would attend in 2020. So first, I want to welcome you to New Orleans and STD Engage 2023. You are 1,200 people strong and beautiful from where I'm standing. In 2021, who would have believed that due to your advocacy and the advocacy of NCSD, we would see $1.2 billion provided by the United States Congress to CDC to more than double the size of DIS in our country, run by STI programs in state, city, and territorial health programs across the country. It was the honor of my lifetime to help make that happen, and it only happened because we believed, I believed, you believed it was possible. How many of you in this room are first-time conference attendees? Please stand. Wow. Okay, now you can sit. How many of you are DIS? Please stand. All right, wow. Now sit. You guys are very good at obeying. I think I kind of like this. I also have to ad-lib for a moment because I had a wonderful lunch encounter with a DIS from Richmond, Virginia, John Whitener. Where are you, John? John and all of you are living examples of the enthusiasm and passion that you bring to this work. John, it was great to meet you. You represent very well the DIS field. How many of you are STI directors and other colleagues from state, city, and territorial health departments? Please stand. All right. That's great. Now sit. I like this. How many of you here are from the U.S. territories? Whoa. Fantastic. Now sit. Believe in the power of networking. Believe in the power of friendships. Believe in the power of your fellow colleagues who are in this room right here, right now. Everyone, I want all of you to stand for a moment, for those who can. And I want you to introduce yourself to one person standing near you who you don't know, your name, your city, what you do. All right. Okay. All righty, now sit. Now you can sit. Now you can sit. Amazing. You are all very good at obeying. So, folks, all righty. Make friends, make professional colleagues. Believe in the power of your knowledge and experience. It will be these relationships that sustain you in the days, weeks, and months and years ahead. Our field, our STI field, is welcoming, friendly. You are all do-gooders, compassionate, and passionate people. This work is hard. You need the support of people in this room. This conference has a lot of people here all waiting to strengthen our sector. It has been a long time coming. This is our biggest conference yet ever, and because of that, I also need to ask for your patience and your grace, a little bit of grace. Safety is our #1 concern. Moving people around this hotel safely is our #1 priority. I have to tell you that we didn't want to turn people away. So expect to be delayed and expect the unexpected. Wear comfortable clothes and shoes. Bring a sweater or jacket with you into meeting rooms. You will get hot, you will get cold, and then you will get hot again. Follow any announcements that we send out via push notification or via the voice of God in our sessions. Follow the instructions that our wonderful volunteers and staff may give you. Moving everyone in and out of this room will be challenging, and we need to go in order. So safety is the first rule here. At the end of this session, you will be riding an escalator down to our masquerade party. Please don't rush it. Don't rush it. Be patient. We do not want to pile up on the escalator. So, this right here will be a test in resilience, creativity, and problem solving. But hey, we are the STI sector. You're the DIS, STI clinics, and STI administrators who know how to get things done and know how to solve problems. This is not a big one. We can do this, folks. Working with us, we will have the most successful meeting ever over the next couple of days. If you have any problems, of course, let a volunteer or NCSD staff member know, and we will work to fix it right away. I think you've already seen the incredible customer service that our volunteers and NCSD staff members bring to this work. A huge round of applause for our NCSD team members. A little later in this opening program, it's going to be my honor to introduce you to Kathleen Roosevelt from Massachusetts and Harold Phillips and Leandro Mena from the White House and CDC. First time we've ever had anybody from the White House, folks. Harold, the expectations are very high. But seriously, these folks are reformers. These folks are activists, and they want to work with you and NCSD on building back a stronger public health system. But make no mistake about it, you all know our field, the public health field, is under attack. Not only do we have rollbacks to civil rights protections that directly impact on all of us in this room, but on the very people we serve in the STI sector. The trans woman in Wyoming who fears they have syphilis, the young gay black man from Mississippi who needs testing and treatment for gonorrhea and to get on HIV PrEP, the Latina woman who sought refuge in Texas from economic collapse in Venezuela but has an undiagnosed STI, the young black woman in New York seeking access to comprehensive reproductive health care and abortion services, the gay man in Los Angeles afraid he has Mpox but doesn't know where to go to get tested and treated and vaccinated. And those are just a few of the examples of what you all face every day. There are people in the United States Congress who want to claw back the DIS money allocated throughout this country. We can't let that happen. Reformers, builders, thought leaders, members of the media, all of you are here right now. STD Engage 2023 is about coming back stronger, and it is about building community, and it is about embracing reform. Listen, learn, and engage with these reformers. They want to hear from you. When I opened STD Engage 2019, I took stock of several things. There was a start of a new movement for sexual health in this country. HHS had announced the first federal STI strategic plan, which we had a little bit of something to do with, and shortly, you're going to hear about another new plan being released right here, right now, from the federal government. It is a big deal. Pushed by NCSD there is a growing awareness of syndemics, the intersection between STIs, HIV, HCV, and substance use disorders. There were calls for more integrated, innovative, and coordinated public health response. And there was a clarion call to address the long-standing racial and ethnic health disparities in all aspects of our work. At our virtual Engage conference in 2020, fighting systemic racism was my primary call to action. Without a doubt, this challenge still remains. Have we made progress? Maybe some, but certainly not enough. And in some areas, as you all know, we've gone backwards. The repeal of Roe v. Wade, restrictions to mifepristone, I butchered that word, attempts to overturn the ACA's covering of preventive services to STIs and HIV PrEP in Texas, restrictions on trans rights, comprehensive sex education, and on and on and on. No matter where you stand on these issues, I really want to clearly state one thing, however. And I'll say it again. No matter where you stand on these issues personally, everyone is welcome in this room. We welcome diverse viewpoints. Our job at STD Engage is not to fight over where you stand personally on some of these issues, or where your state legislatures or even your health departments stand, but our job right here and right now is to take stock on what these issues mean for your work and for the communities you serve. What, quite simply, is the impact on STI prevention and care services, and how do we come back stronger in this current environment of profound change? I want to say a special word to our friends and colleagues who work at CDC. Most of you know CDC is under siege. Members of Congress have demanded data, reports, and reforms. It's taking up all their time. CDC has been criticized relentlessly for its response to COVID, and take your pick of any other issue you want to have a go at them on. I have criticized CDC and HHS in the media. There are many, many things that a lot of us don't understand very well about CDC procedures and policies. Report after report has been calling for change and reform. So, okay, let's change and let's reform. You're going to hear about that in this conference. So this conference is about seeking your ideas on building back stronger and your ideas on how the CDC and all of us can do better. CDC, the White House, other federal government agencies are our essential partners. We can criticize each other at the same time that we love each other. We are a family, and families fight sometimes, but we always make up. We can advance our ideas, ask questions, and be good advocates, and at the end of the day, this makes all of us stronger. You are the leaders and innovators and folks with new ideas. Solving the problems of STI prevention and care comes from all of you in this room, not from Atlanta, or not just from Atlanta, Washington, D.C., or Bethesda, Maryland. Innovation comes from you on the front lines, and you have a responsibility to raise your voice and give your ideas. Change can be frustrating, and reform can be slow. But you will hear from high-level government officials at this meeting, and they want to hear from you. I welcome you to STD Engage, coming back stronger. We are a community to be reckoned with. This is our day, our time, and it is our moment to shine. It is a time for us to demand the resources we need to bring STI rates down in America. I cannot wait to meet all of you over the next few days. Thank you very much. Before I leave for this segment, I want to do a special shout out and thanks to the sponsors for making this meeting happen. Hologic, Diagnostics Direct, Checks Out, Health Merch, Color Health, Let's Get Checked, and the Virgin Islands Department of Health and Tourism. I gotta warn you, We're getting lobbied about doing an STD Engage in the Virgin Islands. And here from the Virgin Islands, Department of Health and Tourism, we have the co-chair of our STD Engage Conference Planning Committee, Mr. Jason Henry. Please welcome Jason to the stage.
Welcome to Engage 2023. I'm also bringing you greetings from our Virgin Islands Commissioner of Health, Husa Encarnacion, and our First Lady from the Virgin Islands, Yolanda Bryan. We have been waiting for over 3 years to meet all of you in New Orleans, and we are excited to be here. All right. Hello, STI clinic staff. Hello, CDC colleagues. Hello, STD directors. Hello, sponsors and exhibitors. Hello, partners in sexual health. And a special welcome to all our colleagues and friends from Puerto Rico, the U.S. territories, and of course, my hometown, the Virgin Islands. Puerto Rico, the Virgin Islands, the U.S. territories, stand so we can see you. All right. But wait, somebody's missing. Do we have any DIS in the house today? No. Let me ask that question again. Do we have any DIS in the house today? Woo! All right. Over the past year and a half, our programs have been tasked with hiring and training new DIS workforce, and we are grateful to see so many of you here today. Our field is diverse and rich, and this conference is a space to spark networking, exchange of information from leaders and peers in our sector. You are all beautiful from where I stand. You know, anyone who knows me knows that I have to have a moment for a selfie. All right. Everyone wave. Wait. All right. Thank you all for attending. I'm so happy to be here today. And I've brought a piece of the Virgin Islands Department of Health with me. So please visit our Wellness Center and our exhibit booth for the Virgin Islands Department of Health and the Virgin Islands Division of Tourism. We have lots of information from the USVI, jewelry from Cruisin' Gold, and our famous Cruisin' Rum. Wait. Did I say Cruisin' Rum? See, that's why we partner with the Division of Tourism. Because can you imagine the rumors at CDC and Congress that the Virgin Islands Department of Health is giving away free rum? Everyone is welcome to come back to the Virgin Islands. And as we say, everyone in the island is a virgin. In all seriousness, we do have a lot to celebrate. This is actually the biggest conference NCSD has ever hosted. And it is incredible being surrounded by so many passionate experts. This event would not have been possible without the work of many. Thank you to the members of the Planning Committee. Planning Committee, please stand. All right. I applaud each and every one of you for your hard volunteer work that has made this conference possible. You met monthly in tons of hours reviewing abstracts and helped to plan these plenary sessions. Thank you from the bottom of our hearts. I am missing my partner in crime, board member, chair-elect, and STD Engage co-chair, Rebecca Scranton. Becca should have been sharing the stage with me, but unfortunately she had a situation. She's worked tirelessly on the board of the Engage Committee. I was truly looking forward to seeing her in person after so many years. Thank you, Becca, for all that you've done and what you continue to do. A huge shout out to Kathleen Genty. I'm sure you've seen her in emails. Ms. Genty is the NCSD lead on all things STD Engage. Kathleen, where are you? We know you're probably running around somewhere. Is Kathleen in the house? We'd like to recognize Kathleen, and also she's given her heart and soul to bring this meeting along with Leslie Martinez, her sidekick. We thank both of you and the larger NCSD team for your contributions and your efforts. At this time, I also like all the NCSD staff to please stand and let us recognize you. And thank you to all the volunteers. Volunteers, where are you? Woo! By the last count that I got, we had over 200 volunteer spots to fill, and we could not have done it without you. Folks, everyone, enjoy the meeting. We look forward to your feedback and evaluations on how we can make next year's meetings even bigger and better, and hopefully soon in the Virgin Islands. In the Virgin Islands, right? VI! Welcome and enjoy STD Engage. Thank you.
Please welcome Senior Public Health Advisor for Syndemics and Co-Principal for STIs in the Office of Infectious Disease and HIV/AIDS Policy, Office of the Assistant Secretary for Health, U.S. Department of Health and Human Services, Nate Fezzik.
Hello, everybody. Good afternoon. On behalf of the Assistant Secretary for Health and Admiral Rachel Levine and my office's leadership, I want to thank you, David, and your team for hosting this event and for the opportunity to be a part of the opening plenary. And echoing the words of Director Walensky, I especially want to thank all of you in attendance who perform the work on the ground each and every day, often in challenging and resource-constrained environments, of responding to the ongoing increase of STIs across the United States. Many years ago, having once been an HIV tester and counselor, I understand the emotional weight of delivering a diagnosis and engaging in often difficult conversations with patients. So I also want to pay respect to the importance of acknowledging our own self-care and self-traumas. So truly, thank you for your work. Today I want to talk about the STI National Strategic Plan that David referenced a little bit ago, including efforts of the federal government to implement that plan, as well as how the plan is relevant to the work that you do each and every day. Then I'll spend a little bit of time talking about STIs in the context of syndemics, which it seems to be a bit of a buzzword, so I think it's appropriate to level set before we dive into that concept. So, as all of you know, the rates of STIs have continued to rise over the last number of years. Recognizing these increases, the impact of STIs on overall health and well-being, and calls of advocacy by many of you in this room, my office, under the coordination of Melissa Habel and federal leaders such as Gail Bolin, Carolyn Deal, and many others, led the development of the first ever STI National Strategic Plan. This groundbreaking document aims to reverse the rise in STIs in the United States. The STI plan sets a vision as well as goals, objectives, and strategies to respond to the STI epidemic. It also includes indicators with measurable targets to track progress. Looking to replicate the successes of the National HIV/AIDS Strategy, the STI plan aims to provide a roadmap for a broad range of stakeholders to develop, enhance, and expand STI prevention and care programs at the local, state, tribal, territorial, and national levels through 2025. And as we've seen with the National HIV/AIDS Strategy, we hope that you and many other stakeholders will adopt and translate the STI plan's vision and goals in the work you do in the places where you call home. Here you can see the vision and goals of the STI plan, which focus on prevention, improvement of health outcomes, research and innovation, addressing inequities, and coordination of efforts at all levels. I encourage you to visit hhs.gov/STI to review the plan if you're not familiar with it. The plan's goals, objectives, and strategies highlight 4 of the STIs that have the greatest impact on the health of the nation. Those include chlamydia, gonorrhea, syphilis, and HPV. However, it applies equally to most STIs. It is also relevant in guiding our efforts to address Mpox. The plan also identifies populations and geographic regions that experience the highest burden of STIs based on nationwide data so that federal agencies and other stakeholders can focus their resources to have the greatest impact. Having a plan that outlines a vision and goals is an important first step in responding to STIs. What is equally, if not even more important, are focused, dedicated efforts taken to implement the plan. And as David alluded to, I'm very honored and happy to announce that today here on this stage, the first ever STI implementation plan has been approved by the Secretary of Health and will be released in the coming days. The STI Federal Implementation Plan highlights action steps that federal departments and agencies will take to implement the strategies toward achieving the STI plan's goals. This coordinated effort, facilitated by my colleague, Lieutenant Commander Nellie Gazarian, right here in the front row, and myself with the input of federal partners, helped shift from what has been viewed by many as the sole burden of our federal response by CDC to a whole-of-government approach. I'm proud to share that 5 federal departments and 15 HHS agencies have collectively put forward more than 200 action steps highlighting policies, programs, research, and other federal activities to respond to STIs. And while we anticipate the release of the document, we recognize that there is always room for improvement and more work to be done. As with the National HIV/AIDS strategy, we expect that with each iteration of the STI plan and related implementation plans, new dialogues between agencies will take place, leading to new collaborations and the breaking down of silos. Here, on the next slide, is a sneak peek inside the implementation plan to give you a sense of what to expect when that document's released. These are just a few highlights of the many action steps put forward by federal agencies across the STI plan goals, objectives, and strategies. For each action step, you will see an agency who's responsible for that action, with the lead agency in bold if there's more than one agency, the time frame for implementing the action step, and the associated indicators. And to increase accountability and transparency, the related funding mechanism is also included. Looking ahead, we will begin the work of developing progress reports to highlight successes and challenges from federal agencies from the initial years of the STI plan, as well as their plans for course correction if needed. The progress reports will also showcase the latest data measuring our progress toward achieving indicator targets. My office will continue to expand our role serving as the backbone organization for implementing the STI plan. We will also work to encourage new partnerships with federal agencies and non-federal stakeholders to advance policies, research, and programs necessary to achieve the goals of the STI plan. Now, switching gears for a moment, given my role in overseeing syndemics, I cannot leave the stage without briefly introducing the importance of discussing STIs in the context of syndemics, as well as defining the term. So a syndemic, for those who are unfamiliar with the term, is defined as the clustering and interaction of 2 or more diseases as a result of social and structural determinants of health that lead to excess burden of disease in a population. The term syndemics was first introduced by Merrill Singer in the 90s to describe the interaction observed between substance use, HIV/AIDS, and violence. He referred to this as the SAVA syndemic. Today, we recognize that syndemics manifest in many different variations across different regions and among different populations. For example, we recognize the syndemic interaction between STIs and increased transmission of HIV, facilitated by factors such as poverty, violence, stigma, substance use, as well as many other factors. Moving forward to the early 2000s, Bobby Milstein, who at the time led CDC's syndemic efforts, created this report, Hygea's Constellation. In the report, he provides an eloquent definition of a syndemic approach, which is, quote, a way of thinking about public health work that focuses on connections among health-related problems, considers those connections when developing health policies, and aligns with other avenues of social change to assure the conditions in which all people can be healthy. In defining a syndemic approach, Milstein argues that health, living conditions, including the social and structural determinants of health, and collective people's power to act are intertwined. That is, each impacts the other. For example, people living in a community with decreased ability to advocate or engage in advocacy for political or systemic change may find it difficult to enact changes to address root causes of health disparities. Similarly, people living in a community with poorly funded education systems, ultimately cascading to experiences of decreased economic abilities or reduced literacy, may impact individuals' ability to make healthier choices. The syndemic approach also calls for the broadening of our focus across the spectrum. This is not a call to abandon a single disease approach, as it will be necessary to continue disease-specific intervention, such as partner services to deliver STI treatment and testing. However, a syndemic approach encourages intervention, such as leveraging resources for integrated service delivery, as well as addressing upstream or systemic root causes of syndemics, such as supporting communities to build public power to act, as well as engaging communities in agenda setting to identify most pressing needs and concerns. Recognizing the important reality of syndemics, my office was mindful to develop the national strategic plans relating to these conditions together. We also included specific goals, objectives, and strategies to address the social and structural determinants of health that facilitate inequities and the clustering of disease. We've also recently convened an interagency working group or committee of senior federal leaders from across many federal agencies to identify tangible opportunities for action and policy change to facilitate syndemic approaches. And as my time comes to a close with you all on this stage, I leave you with a call to action. I believe these plans and a syndemic approach will help renew the focus on the impact of STIs to our nation's overall sexual and reproductive health and well-being. Similarly, it will likely lead to new innovations and increased advocacy by many of you here today for new and additional resources and direction. As you are all aware, the role of addressing STIs does not belong to any one government agency, organization, or individual. It is a national effort that requires a collective response across a wide range of stakeholders for many different sectors of society. And I hope the imminent release of the STI Federal Implementation Plan can add to the excitement and energy here at this conference. So with that, thank you all. Thank you so much. I look forward to meeting you and learning from you. Thanks again.
Nate, thank you very much. That's a big deal that plan got released here. So another round of applause for Nate Fessig. Thank you. I am very pleased to introduce you to this next portion of the program, and my cohort on stage is Kathleen Roosevelt, the head of the STD program for the state of Massachusetts, a member of the NCSD board, and the chair of our board's public policy committee.
Thank you.
So ending epidemic levels of STIs in America is going to take nothing short of an all-of-government response. And as we just heard, thanks to Nathan, we will have this STI federal implementation plan to fulfill the promise of last year's STI National Strategic Plan. The implementation plan will engage, no pun intended, engage government agencies and help us hold them accountable. But a plan on paper is just a plan on paper, and unless it is accompanied by leadership. There is one huge difference between where our field was 4 years ago and where we are now. All of us in this room collectively, that means you, now have the ear of the White House in a way this field has never had before. We also have new leadership at CDC, where we need to have a conversation about priorities, strategies, and how it impacts your work. We are going to have this conversation right now. So Kathleen, welcome.
Thank you. Thanks so much. So as a state STD director and a recipient of PEACHED funding, the funding that's provided by the CDC to states and jurisdictions across the country, we rely on CDC's leadership on a day-to-day basis to give us the tools we need to serve our communities with the funding Congress provides. And even though we need far more of that sustainable funding, maximizing what we do with what we have makes a difference. Please welcome Dr. Leandro Mena, Director of the Division of STD Prevention at the CDC.
And welcome Harold Phillips from the White House Office of National AIDS Policy.
Great.
Oh.
Thank you.
You can sit here on this.
So, Kathleen, we have a very serious matter to take up first.
Yes, David?
And that is that there are two people on this stage that have the most fabulous socks on that I've ever seen.
Well,
It is no match to me or you, Kathleen.
Right.
So we are off to a good start with fabulous socks.
It's true. And I'm so grateful to be here in person and speaking with both of you. So, Dr. Mena, the first question is for you. You have a long history of working on STI prevention and treatment and care. Now you've gone from being one of the people in the audience to one of the most powerful people in STI prevention. In becoming the director, of the DSTDP, what has impressed you, what has surprised you as you've journeyed from the front lines to leading this agency?
Right. Thank you, Kathleen. And I totally agree. I think with leading, and I'm not sure about the power, right? I think that one of my first discoveries is really, not much power. You have, a tremendous ability to influence, but the power is so shared. And I think that in terms of the difference, right, there is the scope, and jurisdiction. At the local level, you work with a region, and you understand the issues, and you have a proximity with the community, and you develop policies very often tailored to specific populations, right? Mm-hmm. At the national level, the scope is so much broader, right? Now it's no longer one particular area of population, but it's the nation, and the diversity. So that's a striking, difference. The second thing I think that is really important, it was important difference that I had to quickly adjust, is the decision-making process. At the local level, you have so much more autonomy and flexibility, that you can swiftly react, to the needs of a community that you are so close. At the federal level, again, the scope is so more broader, and you have to take into consideration a number of stakeholders, and partners, and this decision-making process, becomes very, complicated, and sometimes keeping us from responding, the speed that we would like to. So those are some of the biggest differences. And yeah.
That's great, thank you. So the Division of STD Prevention has a new strategic plan, and it has 6 parts. Can you give us just a very quick, 2-minute overview of what the plan is meant to accomplish? And then I want to ask you a question about it.
So what the plan is meant to accomplish is our vision. And our vision is, a nation where individuals, in communities are empowered to be, sexually healthy. We know that this is something that we're not going to be able to achieve, overnight, but our strategic plan really provides us a blueprint to get there. We went through a lengthy process, reviewing our former plan, reviewing the NASEN report, reviewing, a number of reports that were generated in the last, few years, and then engaging with the division staff, a whole division effort, having listening sessions with many of our partners. Thank you to many of you who participated in many of these, listening sessions that I know have representation from at least 35 different, jurisdictions. Our federal partners, our divisions and CDC provided input. So all that is our strategic plan, right? It's going to be our blueprint of what we're going to do in the next 3 to 5 years. We wanted to make sure that it was aligned with the national strategy, so we took the 5 goals of the national strategy. We added a 6th goal because our staff wanted a goal specifically focused on the investment and the development of our internal workforce. But we really, again, encourage to each one of you in your jurisdictions to take the national strategy and go through your own process so you can come out with your own, local strategy. Together, we can really, again, address, the STIs, the challenges that we are experiencing, the historic high rates of STIs. But we need to work together. We need to have a plan. Each one of us need to have a plan that is consistent.
Great. So my follow-up question is, which one of these excites you the most?
Yeah, that's a wonderful question. I think that they all complement each other. So I don't think that I have necessarily a favorite. I don't think that they all work with each other. If you look at the goals of the strategic plan, decreasing STIs, preventing morbidities, addressing inequities, the discovery and innovation, the integration, they all work together. So I think that they all, they all work together, and without them, we would not be able to realize the vision of our plan.
Thank you.
That's great. Thank you. So the next question is for you, Harold. This is a perfect bridge to talk about people's needs and how they don't necessarily fit into neat buckets. So, Harold, syndemic is the hot buzzword in the field right now.
Very hot.
Can you tell us what syndemic really means and the role a syndemic approach should take in our work together?
Great. Well, first, David, I want to thank you and the staff and the board for inviting me to be here with you all today. Nate talked a lot about the syndemic and talked about sort of various factors that are impacting communities and populations. And we've seen it very visibly in part of the COVID response. And thanks to many of you all who were on the front lines during the COVID response and ready to switch gears and respond. You did the same thing when it came to Mpox. So on top of our STIs, we have had infectious disease outbreaks. That's a real-time example of the syndemic and the impact and the need to reach populations who often aren't engaged in healthcare in the first place. This is why you all were so effective at the pandemic response, because you already had these relationships with the community, and you were able to make a response quickly that was needed, and you were able to engage and get services and information. People didn't trust the federal government in many cases, and it was you all who were the voice that the community needed to hear from to understand how to be safe, how to be well, and how to protect themselves. So we have real-life examples of syndemics and a syndemic response as well when we think about that sort of fancy new public health term.
Great. Thank you, Harold. So as I referenced a little earlier today, we have never had somebody from the White House at our annual conference before. And this week, we not only have, yeah, that's an applause. Not only do we have Harold, but we have, I think as everybody knows from the program, Dr. Dimitri Daskalauskas speaking on Thursday morning about Mpox, which is all in the news this week about a possible resurgence. So we have two people from the White House at this conference this year.
Yep.
Does this mean that people here have the ears of the White House?
Absolutely. Not only do they have the ears of the White House, but they also have the eyes of the White House. In December of 2021, President Biden released a new national HIV/AIDS strategy that was referenced a little bit earlier as part of the presentation. And within that strategy, it talks about the need to address the syndemic and really look at the intersection of STIs and HIV and viral hepatitis as part of the plan and part of the effort. You all also have the eyes and ears of the White House because of the Ending the HIV Epidemic initiative, where we're focused on the 57 jurisdictions in the United States where we have the greatest HIV disparities. That also includes 7 rural states. Within those areas, there has been additional funding that is specifically for STI clinics and programs to provide HIV prevention, testing, and linkage to care for those who are positive. So we're watching and we're listening, and you all have done a tremendous job in scaling up HIV testing and linkage to care, and we're getting some really great results. So not only do you have the eyes, but you got the ears. We're watching and continuing to look at different ways to work with the STI sector on addressing the HIV epidemic. And David has heard me say this, and Rachel has heard me say this, that we're not going to end the HIV epidemic unless we address the STI crisis in this country.
You heard it here first, folks. a representative of President Biden singing our tune.
Sing your tune.
I'm going to push you a little bit, Harold.
Okay.
I'm going to push you a little bit. So as we look toward President Biden's 2025 budget request that goes to the U.S. Congress, it's no secret that this is a tough time for funding increases. Yet our field remains woefully underfunded. What more can the White House do about this?
I love the fact that you asked me about the 2025 budget, because the 2025 budget is not yet baked in stone. 2024 has already been submitted and is working its way through the legislative process. But like you said, this is a tough legislative year for us. There's a lot on the table. The president has requested increases in EHE, $850 million. A portion of that will go to STI work as well when it comes to HIV. But when we think about 2025, there's still time for this. I think there needs to be additional work for individuals to understand the intersection between the STI work and the other work that we're doing, both not only in the infectious diseases that we know about, but you all played a great role when it came to pandemic preparedness. This time, thank you. This time it was sort of an afterthought of, oh, they can do this, and getting you money. I think any future pandemic preparedness plan must include you all as an important component of that work. The other thing, is there's a need for individuals to understand the connection between STIs, social determinants of health as well, and really think about what are some of the models and ways that we can increase funding to STI prevention and treatment and address social drivers of health, health equity, and also work to end the HIV epidemic and the viral hepatitis epidemic as well. So, and our opioid crisis. So you all are at the intersection of all of these, and I don't think there's enough understanding about it. I think we can do more work when it comes to having those models and also being able to be clear about what the budget request is.
Thank you. Thank you, Harold.
Great. Thanks. So my next question is for you, Dr. Mena. As a Peached grantee, one of the things we always hear is that no budget increase can actually happen unless the CDC requests it. Is that something that DSTDP is pushing CDC to do?
Well, what can I say? You know, I've been told that we're not supposed to ask for money. To be honest with you, there has been increased, interest, tremendous interest, from the Office of the Director, about the STIs epidemic. And the last, in the last 3 months, I have given, 3 different briefings, around STI issues, congenital syphilis. And in every single one of those, I present to them as a key driver of these STIs is the insufficient funding, that our programs have. That's as much as we can do in terms of advocate. There are decisions that happen that take place at the level of the OD and beyond, right? That determine, the final, funding request that the president makes.
Yeah, thank you. Thanks. So next, I have a question for both of you, actually. This is a tough time politically, especially in the states that many here live and work in. And the administration is helping where it can, and we're grateful for that. At the same time, we have to navigate administrative burdens that make it really hard to serve our communities. There's an enormous amount of frontline wisdom in this room. And I want to hear from each of you about how you're getting feedback from people who do this frontline work every day, and when we need you to step in and offer support, and when we need you to step back and let us get the job done.
Okay, happy to start. So we get feedback, primarily, our program officers are really, at the front of the work, working with our programs. So that's, I think, that's the first source of information. Then we have, we support jurisdictions and programs in different ways, providing, direct technical assistance, APAs, that's another way. We have, direct communication with our grantees. The board of NCSD, we have monthly meetings, that provide, feedback, bring the voices and concerns of its members. We are having actually listening sessions. I mentioned the listening sessions that we had during the development of our strategic plan, but we also conducting now listening sessions as we are thinking about how our next, pitch novel, right, is going to be designed. And these are strategic. These listening sessions are being specifically crafted to make sure that we get a diversity of voices. We, have, a communication. I personally have, many of the members of the division communication with members of the academic community, consumers, community-based organizations, key opinion leaders, within the community that really help us. I mean, and particularly for me, talking about what's new, right, is how quickly you can be isolated, working, at CDC in the federal government and disconnected, right, from where the work happens and the communities that our programs are serving. So that has been one of the biggest challenges, and making sure that, that we keep, that I keep the lines of communication open to give opportunity, to have the opportunity to listen, to the people that our programs, are affecting.
So I would say, for me, this is my first STI Engage conference. Woo-woo to the other STI Engage versions. But, I'm in contact with David and Rachel on at least a monthly basis. And they work tirelessly, I think, as both advocates for the community and those that are doing this work to ensure that their voices are being heard in Washington and at the federal level. Last week we had a White House roundtable meeting where we invited individuals from the community as well as the federal government to really talk about sort of the intersection of HIV and sexual health. And we purposely titled it that way, and we also invited Dr. Minna there too, to really sort of talk about sort of not only this endemic, but also what does a status neutral approach look like? And I kept coming back to thinking about a status neutral approach really looks like the approach of those who are doing the STI work. And so it really made me think outside the box about what are the opportunities for both funding and programs, and how should we be sort of crafting our funding opportunity announcements on the federal level to allow that flexibility to meet individuals where they are and to engage them in sex that is sexual health, sex and sexual health. That is both safe, consensual, nonviolent, and pleasurable. And so what does all that look like?
Thank you.
That's great.
I had to think about that for a second. That was great. Thank you. Thank you both. And Leandro, thank you too for your response. You always take my phone calls and texts and emails and phone calls where I do nothing but complain. And you are always very, very good-natured about it. I don't know quite how you do that, but I appreciate it. Thank you. And the same is true for you, Harold, as well. So here we are. So both of you, again, are here, and we're opening up this conference with the theme of coming back stronger. We reflected on our contributions during COVID and Mpox, and obviously we're here together in person for the first time in years. We're going to spend the next 2 days connecting and learning from each other. So what do you think our sector, our field needs to do to come back stronger? This question is for both of you, and I think I'll pick on you first. Harold.
Oh, okay. I think for me, thinking about the field and coming back stronger, I would like to see us sort of reframe how we approach sexual health services. And you know, as I just shared, sort of having the White House round table last week, which really got me thinking about this approach. And I'm borrowing this from someone else who said this. You know, the approach used to be that we catch them, treat them, teach them, and release them. But I'm thinking, you know, we don't just have sex once in our life, or at least I hope. And we're probably not just going to need sexual health services once in our life. And if we're thinking about this endemic, then individuals have a myriad of needs. Why can't sexual health services be sort of an entry into healthcare or entry into primary care? So really thinking about how do we reframe that relationship so we catch them, teach them, treat them, and keep them.
That was beautiful. Thank you. Leandro.
So I would say that with millions of infections being diagnosed every year, it will really take all of us working together, you know, to address them. I think there is tremendous power in the numbers, right, and the collaboration that we all, you know, can bring together. I think that there are, you know, things that are going to make us stronger, right? I think that we have to increase accountability and recognize that, as I said before, neither CDC nor STD programs alone can do this, and we really have to engage, you know, with the healthcare system, broader healthcare system, with programs, you know, that are providing services, and providing services, you know, to the populations that we recognize are disproportionately affected by STIs. We need to re-envision how we deliver in sexual health services. You know, Harold just mentioned about, you know, meeting people where they are, right? You know, and that's critical. You know, where are, you know, people receive services. So what can we do, you know, in terms of trying to couple, you know, sexual health services, you know, in spaces that people recognize as safe, non-stigmatizing places to improve access and utilization of these services. And finally, we really need to invest in the kind of innovation that we need to bring sexual health to the 21st century. You know, there is a tremendous investment and commitment to this investment that we all have to make as a nation. But I'm confident that we all will come back together stronger.
Thank you.
Yeah.
Great. Thank you, Leandro.
Yeah, this has been really wonderful, so thank you so much. And on behalf of the board, our members, and everyone here, we want to thank you for helping us kick off STD Engage 2023 and for your continued collaboration to end America's STI epidemics.
Thank you. Thank you to all of you.
Please welcome, from the Louisiana Department of Health, Rhonda Thomas.
First, I have to give a shout out to my entire team at the state of Louisiana, the STD HIV hepatitis program. Y'all stand up. All right, got that out the way. Okay. Already here at STD Engage 2023, you have gotten to hear about the new National STI Implementation Plan. You have heard from the White House, the CDC, and now you've heard from NCSD's own leadership, all talking about a vision for a sexually healthy nation. In your time here at STD Engage, you're going to learn so much about how to put this vision into action, and your colleagues from across the nation are going to learn so much from you. It's time to get down to business. I am proud to introduce two friends from right here in New Orleans who, like you, have worked to keep this community safe during COVID-19, during Mpox, and in the ongoing work to diagnose, treat, and prevent STIs and HIV. And they are making it fun. I am proud to introduce to you the co-founders of Noise Filter. Dr. Mark Allen Derry is an infectious disease specialist who has worked on HIV, STIs, and hepatitis all over the world. And Dr. Eric Griggs is a community medicine doctor and health educator. Together, they launched Noise Filter, a platform to inform people, destigmatize and normalize sexual health, reflect the lived and historical experiences of their community, and keep their community healthy. Please welcome Dr. Mark Allen Derry and Doc Griggs.
true. You do look beautiful from here.
Dude, I think we live in here.
Right.
This is our area.
This is our lane, right?
This
Okay, got it. All right, Eric.
So
these are the directors of cooties departments. That's right.
So as you can tell,
and Eric, and what rhymes with cooties that you're going to find a lot of in the French
Doug,
program?
you can't say that. No, you can't.
No,
y'all
dude.
can't think
no,
that either.
No. Foodies. You're going to find a lot of foodies in the. Oh, you guys are bad. You guys are bad.
So well, as you can all tell, I'm the funny one in the bunch. And I'm responsible for all the funny jokes, and he's responsible for himself. Yeah.
Set the stage.
Yeah.
You've now set the stage.
So what I'd like to do, as you can tell, Mark Allen has a mastery of dad jokes. So I want everyone to pretend we're as old as Mark Allen, because he's much older than I am. I want you to close your eyes, and I want you to think back to a time, if you were Mark Allen, on a Saturday morning, you're in your jammies, there's no school, pay no attention to what you see behind, and you have your biggest bowl and your favorite box of cereal with a whole gallon of milk, and does everyone have that special spoon? Am I the only one? Do y'all remember? Yeah. Give it up for the spoon. So that's setting the stage for what we're going to do. Yeah, keep your
spoon ups, because now we're going to set the story of what happened. So one day, Eric and I, pre-COVID, because there was pre-COVID, Eric and I did a lot of radio and media together.
Long ago. I'd love to say I had hair back then, but it's not the case. I didn't.
And I had been saying, we got to watch this virus. We have to watch this virus. It's an RNA virus. This is what we've been waiting for. And so as soon as COVID hit, Eric and I had already been doing media. And we'd been on a number of radio programs. I started a radio station here in town called 102.3 WHIV. Yes, I named it WHIV.
Yes, you did.
Which has now served to destigmatize HIV here in town, because when people come up to me and ask me about HIV, I don't know if they're talking about the radio station or they're talking about HIV. And so, I don't know, a couple months in, as mRNA vaccines start to become a thing, I turn around to Eric and I say, do you want to be in a cartoon?
Yes. Yes.
And we decided that we were going to start making animations. And today, you guys are going to see a sampling of some of the animations that we've made for you. These are free. These are on our website.
Wait, how much are they?
Free, totally free.
No. What about Saturdays?
What about the Saturdays?
How much are they on Saturdays?
What's that?
How much are they on Saturdays?
Oh, well, you have to bowl cereal with a spoon.
What about on Mondays? How much are they?
They're free too.
Tuesdays?
They're free. They're free.
I think they're free.
No licensed.
They were
a lot of these were also paid for with NIH dollars and HRSA dollars. So they're meant for you, for your health departments to be played in various waiting rooms that you guys have. So with that being said, we want to show you our first one that we ever did called the Valiant Vaccine and the Vicious Virus. And when you guys are done, you will understand mRNA much better than you do right now.
Spoons up.
Spoons up.
Hey ho, let's go. I'm Dr. Mark Allandary, and I'm an infectious disease doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. Speaking of special, today's podcast is coming live from inside the human body.
So, Doc Griggs, does that make it a podcast?
Dude, don't make me regret sharing my space-time hop trick with you. Thanks, TV sitcoms.
So, these COVID-19 vaccines are super safe and effective, and thankfully, were developed quickly in response to the global pandemic.
First, let's explain how the coronavirus makes us sick. Ooh, check out those spike proteins on the coronavirus. They help it burst through healthy cells, where it replicates inside, destroying the cells and making us sick. I really hate that dude.
The vaccine will take care of him. Vaccines stimulate your immune system to fight viruses. Some of the COVID-19 vaccines work by delivering mRNA to your cells. Think of mRNA as instructions that activate the immune system.
Let's check out a healthy cell to see how mRNA works. The COVID-19 vaccines deliver a package loaded with millions of mRNA to your cells. Then the ribosomes read the genetic code on the mRNA like a manual and produce spike proteins that mimic the COVID-19 ones. That stimulates your immune system to make antibodies. Now, off to the lymph nodes.
Here's where antibodies are created. The heroes that fight coronavirus. The spike proteins attach to the antibody, leaving an imprint of the spikes. basically setting a trap for the nasty coronavirus.
When this part of the antibody attaches to these spike proteins on the coronavirus, it immobilizes the virus and stops it from infecting our cells and making us sick.
If an actual coronavirus comes into the body, the antibodies are ready to rumble!
Battle faster!
That's why COVID-19 vaccines are essential for teaching your immune system how to fight off the coronavirus.
And that's our show for today. Ready to roll?
I've got this.
Not bad for our first time, right? Yeah. Not bad. And it went viral.
Oh, seriously, come on. Y'all thought that was funny? Really?
It went viral. Oh. Our brothers and sisters from Chicago.
Chicago in the house?
Where are you? You guys cheered a lot louder earlier. That sounded like there was a lot.
That joke was that bad.
Yeah. We dedicate this next animation for you. This is one of our newest ones that we are focusing, because what we want to show and what we want to do, and as Eric and I are trying to build out what Noise Filter is, which, as we say here, Schoolhouse Rock for health and health equity in the 21st century. We want to present these topics in a way that's interesting and fun and funny, hopefully.
No.
This next one is on Mpox, so we're going to do the Mpox one right now, and you're going to get to see Eric wearing, we did a West Side Story version of it, so you'll see Eric in a Letterman jacket with his rolled up Levi's as well. He looks great.
Just stop?
You want to roll?
He laughs at his own jokes.
Let's go ahead and roll that one.
When you're a pox, you've been here for a while. An oval-shaped virus that's catchy and vile. We love to cause nasty rashes and sores, lesions that itch using pus from your pores.
When you're a doc, you got facts on your side to stop all these poxes from getting inside.
Washing your hands, don't roll around in sheets, avoiding skin to skin when you meet and greet.
Once we're inside, we cause chaos in your system, blisters and chills, and lots of other symptoms.
When the Mpox virus appeared on the scene,
science was ready, we had a vaccine.
Getting your shots will mean not getting sick, and stopping transmission is just a small prick.
We're gonna beat every pox on the street, on the whole chicken clocking street.
Why a chicken? We never found out, but the animators put that in there.
They really did. Yeah, they really did.
The next one.
Yes.
So we've been working, very fortunate to work with HRSA, as I said, NIH, Tulane locally here, but it was the phone call from the 100 Black Men of America who said they wanted an animation.
They wanted an animation for kids. A high-functioning society is child-centered, adult-governed, and elderly-ruled. We were focused on the kids, I was the adults, and we have the elderly here. Kids, if you talk to kids, if children walked in this room right now, all the adults pay attention, and it provides a barrier and a cover for what we live in. We live in the lane of health literacy. A lot of times you'll get patients that'll act like, oh, you know, I can't really see, even though you might have just done their eye exam and it's 2020, when they can't read, or they don't understand. So there was no better time than the pandemic to try to explain things to adults through the eyes of kids. Is anybody else's cereal getting soggy right now? Freshen up your bowl and let's watch the next video.
This one is check clean cover.
Yeah.
It's just check clean cover, yeah.
Yeah.
Yeah, check clean cover.
When you spy with your eyes a bit of bleeding from your skin, it's important to act quickly before bacteria get in. Those tiny germs will multiply, leading to infections that can cause the cut to ooze green pus, spread to other sections. Let's hear it for the 3C
Carmen cut her chin on the cement curb.
Clearly careful, this corner is chaos.
I think I see what you guys are up to.
Check out the cool cloud!
Check.
Taking out the dirt and rocks.
Clean.
Soap and water, creams and drops.
Cover.
Gauze or bandage from this box. We're ready to rock and roll. Thank you, docs.
I really do know how to skate.
So getting a little serious here, we've seen, I think, something like 430 anti-LGBT bills across 50 state houses this year. Same thing last year. And as there's been this spotlight, target really, on the LGBT community, we really felt it was necessary for us to take our platform and focus some very, very strong positivity and love on the LGBT community. And that's what this next animation is.
So what did we do? We created a cartoon. Yes. Yes.
Cartoon with local activist Milan Nicole Cherie, who's a person of trans experience, who's also open about her HIV experience and her HIV life here in town. Again, she's a leader here in the, amongst the trans community, and when we tapped her, again, it was just the same answer that Eric gave. She's like, yes. So we did 3 of them with her. We're going to show you the U equals U one, but we have one on PrEP and we have one on PEP as well. So those are also available for you guys to use as well. But we really like the U equals U one. And in it, Milan Nicole Cherie schools Eric and I on all things HIV.
Daily, every day. This is one of our favorites. Yeah,
this is one of our favorites. So enjoy this one, U equals U.
Hey ho, let's go. I'm Dr. Mark Allenderry, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. On this episode of Noise Filter, we're talking about HIV and U equals U.
Dude, that's my specialty. Let me start.
Nah, let me explain it, big guy.
Hello, boys.
Milan Nicole Cherie? No freaking way.
Y'all better stop fighting over who gets to mansplain U equals U. I'm running with it. And yes, in these hills. HIV and people of trans experience are often misunderstood. Taking a peek inside my body will help explain it better. No mystery here. My body works just like yours and all y'all watching. Check out my CD4 cells. Don't they look good?
Oh,
fabulous.
Wow.
That
Amazing.
looks great.
CD4 cells produce antibodies that protect you from infection.
Imagine your immune system is an orchestra and the CD4 cells are the conductors.
Hold up. It didn't always look like this. Let's rewind. HIV targets and destroys CD4 cells, which reduces antibody production and immune protection. See here, my HIV viral load was high and my CD4 count was low. I got tested for HIV and started medication. Look, my HIV medication is working. My CD4 cells and antibodies are back, and now my HIV viral load is down. Ta-da! With an undetectable viral load, I am now untransmittable. U equals U. I have 0 chance of transmitting HIV to my intimate partner. People living with an undetectable HIV viral load can have the same life expectancy, quality, and enjoyment of life as people not living with HIV, including being intimate without fear of transmitting HIV. Hey now, that is none of your business.
Increasing HIV testing, diagnosing, treating, and maintaining lifelong care can get us to an HIV-free world.
Milan, there's no one better than you to talk about
U equals U.
Yeah, you're right.
You guys will be doing a second line, I think, very soon.
Oh,
so
yeah, they got the
second
umbrellas.
line in New Orleans.
I saw some fans in the bag. It's going down. Dude, what is that on your? What is that on your back?
Check this out.
Social distance. Yeah. What is that?
Pandemic doctor for a pandemic doctor, right here, man.
See what I put up with all the time? Every day.
A very loving wife. How do you make your pandemic doctor happy when he's depressed at home during a pandemic?
You make him a vest.
You make him this. Speaking of which, when cases were going low just right before the Delta outbreak, my wife and I were planning to go to England to go see one of our favorite bands, a band called...
this is that one.
A band called The Specials, a two-tone movement, a great band. They play a brand of music called ska. Yeah. Two-tone represents
I hated that genre until now. Yeah.
So because the show got canceled because of Delta and we had to work and all this stuff, I walked into one of our production meetings. I was like, there's no argument, like there's no discussion. I have the next video. We're going to make it about hepatitis C. We're going to call it Test, Treat, Cure, and it's going to be done in an MTV-like video for the ska show that I missed in England, and that's what we did. Enjoy this one. This is Test, Treat, Cure, and you're going to see Doc Riggs.
Dude,
with his
we promise you will never look at your liver the same.
That's right. You will never look at a liver ever the same again.
This organ is your liver. Looks like a football gone flat. It filters toxins, cleans your blood, metabolizes fat. Test, treat, cure. You need a healthy liver, yeah, it's vital for survival. That's why we need to talk about the liver's biggest rival,
the virus, hepatitis C.
Hep C attacks the liver that can lead to cancer, but do not fear this virus here, cause there's a straight up answer. You gotta test. Simple blood test does a trick.
Takes a few minutes and results are quick.
You gotta treat. Antiviral medication
cuts out cancer from the equation.
Taking steps to be Hep C free means healthy livers for you and me. Test, treat, and cure. Test, treat, and cure. Test, treat, and cure. Test, treat, and cure.
Try getting that earworm out of your ear. That's going to be stuck.
That one is an earworm, right?
That's an earworm.
Cure. Yeah, I'm sorry.
Also, that one went viral too.
Just stop. Will you stop, please? Stop encouraging him.
When you're an animator and you can't make your favorite band's concert in England, you could just make a cartoon about it. It works out just great with a great message too.
Yeah. I must say that is, of that genre, that's my only favorite song.
We were going to do another, but we're running out of time, so we're going to just skip to the end. But we do have, on our website, we do have a whole section of live non-animated videos that are addressed.
And how much do they cost?
They're free.
Oh, okay, all right.
They're free. These are also paid for by HRSA dollars, so anybody here who's from HRSA, thank you very much. These are meant for patients who just received a diagnosis. So we did one on chlamydia, gonorrhea, syphilis, hepatitis C, HIV, one on PrEP, HSV, and HPV as well. So the one that we were going to show you was an abbreviated syphilis one, but we just don't have time. The syphilis one is on the website now, and we're slowly feeding that website with the more content. The editors are editing it. If you just give us the email address, we will update you guys when new videos are updated, because those are the ones that you guys are going to really want, because they're really good. They take it from a doctor's perspective, a patient's perspective. The patient repeats what the doctor says, then the patient goes to his or her partner or their partner and then also tells them. So you see multiple different ways. So we're modeling really positive behavior, including modeling the behavior of talking to the contact tracers as well, if it's a disease that needs to be contact traced. But we're going to skip.
Yeah, we're going to skip to the last one.
Yep.
And that one, so I want everyone to really take a deep breath in and blow it out to decompress. Because the people in this room know more so than anyone the stress and the trauma and the divide that we've all been through for the last 3 years. At the height of the George Floyd incident and era, we were at the very front. I'm on television every day in front of 1 million people, and somehow they found my house. And at one point, if you remember, I had to stop jogging because of the divide. We'd lost the art of civil discourse in this country. And it was like we couldn't agree to disagree and walk away with mutual respect. And the best way for us to deal with distrust is to have those hard, honest conversations, but talk to the kids so nobody gets mad, right? We all learn.
Absolutely. So this is an animation in which also was paid for by the NIH. They were like, can you please do an animation for clinical trials to get people interested in clinical trials? They loved it, they promoted it, but they came back to us and they said—
At the height of healthcare distrust,
they're like, can you make it less interesting? So we had to do it again, a second one that was not quite as interesting as this one. And this one is our favorite.
Yep.
We're going to do this one, and we'll come back because I think it addresses some very important things.
Start drinking the bowl.
We'll never get to the gig on time now. I'll be able to play the bass tonight, right?
Sure, bud. I'll grab a bandage.
Irma Thomas? The Soul Queen of New Orleans?
That's me. I'll get you to the gig with a little detour. Hop in.
You're gonna need a wrist splint, antibiotic ointment, a bandage for the cut, ibuprofen, and a tetanus vaccine.
You know what all those things have in common?
They were developed in clinical trials. I know all about those. I personally led clinical trials for over a decade.
Many folks don't know what clinical trials are or how they work.
There's nothing secretive about them. There's about 300,000 trials going on every year.
We want people to know about them. What's happening?
Take it away, Doc Griggs.
My man, Doc Gary's having some issues. His wrist's all floppy like a soaking wet tissue. His head is pounding and it's got a big gap. Sorry about that, bud. I feel like in phase 1 is just a couple of folks. If everything's safe, then we widen the scope. The clinical trial moves on to phase 2. Lots more people and effects to review. In phase 3, there's a bigger collective. Gotta make sure that the treatment's effective. A stamp of approval means we're on to phase 4. Checking for effects when you walk out the door. Now here's your new treatment. It's proven and safe.
And I can rock out on my super cool bass. Yeah.
Hold up. We need to address the elephant in the room. I'm grateful for these medical discoveries, but this country has a dark history of people like me being mistreated by the medical community.
Sadly, you're right. Black and brown people were abused and lied to by the scientists and the doctors who took an oath to protect them.
It's little wonder that there's suspicion and mistrust around clinical trials and new medications within communities of color.
Absolutely, Miss Irma. And it's because of that history that we have protections in place, ensuring that trials are ethical and safe for all participants.
And why public health professionals, scientists, and doctors leading clinical trials are more diverse than ever.
That is reassuring. I want the best medical care for my grandkids to live long, healthy lives, but they need to trust that doctors will treat them fairly and with respect.
There's work to be done earning the trust of Black and brown people, but changes like these are moving us in the right direction.
Thanks, Miss Irma. This journey was really important. And addressing the elephant in the room made him a lot less scary.
Indeed. And now let's get you to that gig on time.
Come on. Thank you guys very much.
Yeah, we want to thank y'all and hope this is the kickoff to a wonderful, wonderful conference.
100%. We want to thank the NCSD. Thank you guys so much for having us. Thank you guys. You guys are a beautiful audience. Thank you. All of this information that we gave you, you can find at noisefiltershow.com, noisefiltershow.com. These are our own personal QR codes. You can reach out to us that way as well. We're happy to share all this content. It was all built for people like you. When I found out that this was coming here and there was 1,200 people who could use this information, we were so grateful because all we want to do is make sure that content gets out and helps people like you do the amazing job that you do. Thank you, guys.
Thank you, thank you, thank you.
Everyone, please welcome Michelle Allen.
a wonderful time? Are you not engaged? Okay, so I have a couple of things that I want to say to you before we get it going. Things that you just need to know if you work in this field. What color is the STD prevention ribbon? Green. That's right. Say it again. What color is the STD prevention ribbon? Green. The reason why you need to know that because everybody knows what color the HIV prevention ribbon is, and what color is that? Red. HIV is a STD, y'all. We heard Mr. Phillips. We have to have conversations that occur at the same time, do we not? So we are getting ready to have some fun, but before we get ready to have some fun, David started with a roll call, and I want to finish. So I saw that we had a lot of DIS in the house. Make some noise, give it up. But I want the DIS in the house to know something about all the people around them. If you have ever been a DIS, stand up. Woo! And guess what? I am standing. So you can tell by this accent that I am a Georgia girl, and it is as sweet as our peaches. But speaking of Georgia, are the members of the great state of Georgia in the house? Where y'all at? All right. And what about their STD director, Latasha Terry? Yes. So now I want to ask you a few more questions. David asked if this was your first Engage. What about if this is your second, third, or fourth Engage? Will you make some noise? So we must be doing something right if you keep coming back. So now we are going to have some fun. David gave you a few announcements. We are getting ready for a masquerade ball. And in order to do that, we have to get there via the escalators. And remember what David said. Don't rush. Be patient. Be safe. Be flexible. But believe it or not, we are going to be let out by. And I am told that in New Orleans, where the food and the hospitality is just awesome and amazing, if you've had some good food while you're here, say, make some noise. I have been told that when you say, let the good times roll, something magical happens in New Orleans. Am I right? So the band is coming. Band, where are you? There they are. All right, y'all gonna follow the band out. Put the heels on.